I have helped over 10,000 people understand health insurance, and today I'm going to talk about how to make the most of your health insurance plan and keep some extra cash in your pocket. My name is Diana and I'm a licensed insurance agent in California. I have contracts with all these insurance companies and more. I also work with Covered California. So let's assume you have health insurance, and it doesn't matter if it's through your job, you buy it yourself from the exchanges or directly from the insurance company, or if you have Medicare. If you have to pay copays, deductibles, coinsurance, and other big bucks for your healthcare, then this video will definitely help you make sense of it and save some money on healthcare you get from doctors, hospitals, and other providers. I will give practical advice and tell lots of secrets without charging you any money or asking you to sign up for my courses. I don't have any. So first, if you want to save money on your health insurance, you need to understand one very important thing. Know what your insurance covers. Have you ever read the insurance policy or the summary of benefits? Do you know what does your health insurance cover? What it's not covered by your health insurance? How much do you pay for doctor visits, prescriptions, surgery, and so on? Well, knowing what's included can help you plan your healthcare needs without any surprises later on. Once in a while, I talk to new clients who call me to change their insurance plan, and I ask them, well, why do you want to change your insurance plan? And people say, well, it's so expensive. Okay, I say, what plan you have? Oh, we have a platinum plan. Okay, platinum is the most expensive tier, if you know. If you don't, I have a basic explanation in one of my videos of the tiers and coverage and update. I try to update it every year to keep up with annual changes, so you can get an idea of how bronze, silver, gold, and platinum works. Check out, I'll try to post a link of this video, of the latest one. So back to my conversation with the new client, I asked them, so you have a platinum plan, you pay quite a high rate. Now tell me, how many times did you use your health insurance last year? Oh, we didn't use it at all. Okay, I say, why did you get the most expensive plan in the first place if you don't use it? See, people don't fully understand how health insurance works, and out of fear, they pay lots of money to get the best health insurance plan just in case, and this is incorrect. See, knowing how health insurance works or how your plan works will allow you to make smart decisions about a plan selection. And you don't wait until the last day of open enrollment to make that choice. I highly recommend spending 1 or 2 hours and learning the fundamentals of health insurance, and this alone will save you money for the entire year on premiums, copays, coinsurance, and so on. Well, see, even if you watch a few of my videos on this channel, you should already have a strong understanding of how health insurance works, okay? Look at the benefits of each plan and see for yourself what you use the most. How much is the doctor visit? How much do you pay for a lab test? Is it subject to deductible? What is the maximum out-of-pocket cost? And so on and so on. If you expect to see a doctor less than 2 or 3 times a year and you are low risk, then maybe a bronze plan will be just fine for you. If you're already pregnant or have a planned surgery, then obviously a platinum plan will be ideal in this case, right? So I hope I made it clear that the first step in saving money on your health insurance and eventually minimizing medical expenses is to learn how your plan works. Very easy. Just read and understand the summary of benefits and make the right choice. Again, the summary of benefits is available from the insurance company. Ask your agent and you should be able to get that document. Next, make sure to use emergency rooms appropriately. If you go to emergency room with any minor health issue and you're going to pay quite a lot for that visit, That applies if you have private health insurance, of course. Unfortunately, people that have Medi-Cal or Medicaid in other states don't bother to care about the cost and use the emergency room as their primary care office. This is unfair, of course, to those who actually have real life-threatening emergencies and have to wait for 2-3 hours in the waiting room while the doctor is busy fixing a sneeze or something. So, dear people, if you have minor health issues that need to be addressed urgently, not an emergency, but if it's something that needs to be done relatively soon, then please use the urgent care. First of all, this will cost you less. For example, if you have a bronze plan, you may be paying a fixed copay of $60 for urgent care. If you go to the emergency room with this plan, you will be responsible for the entire bill because your bronze plan is a high deductible and you pay all the costs for the ER up to this amount or up to the max amount of pocket if the bill ends up being quite high. Okay, so I think you got it. Go to the urgent care with minor urgent needs and leave emergency room for life-threatening emergencies. Okay, I'm clear on this one. Next one is next tip to save money on healthcare cost is to stick to network providers. Here's a cool trick. Use doctors and hospitals that are in network with your insurance. Very easy. These are places your insurance works closely with, so you usually pay less when you go there. It's like getting a discount without even trying, right? This mainly refers to those who have a PPO plan and believe they can go to any doctor. Yes, you can go to any doctor. However, the one that has a contract with your insurance company will bill you less than the one who is out of network. If you have an HMO plan, then you need to stay in network anyways, right? The easiest way to check networks is by going to the official website for your insurance. They have provider networks on their website available openly for the public. No need to log in. You can just input your plan and then search for doctors and so on. Also, if you want to save money in the long run, don't skip preventative care. Don't forget about those checkups. They are not just good for keeping you healthy, they also usually free with your insurance. Prevention is easier than treatment of a disease that has been undiagnosed for on time. So really making the annual checkup appointment should be one of the first things you do once your health insurance is in effect. Again, you pay $0 for annual checkups and it does not matter what health insurance plan you have, bronze or silver or gold or platinum. Okay, so next, also you may try Tella Health. In other words, this is talking to a doctor on your computer or phone. This is super handy. You can get medical advice without leaving home. Plus, it's often cheaper than going to the doctor's office. So obviously, this doesn't replace the physical, and it's not always advisable. But for quick questions, advice, confirmations, this is a good option that you may save you money. So. Since we're talking about healthcare costs, I can't avoid the topic of medications, right? So one way to save money on this is go generic with prescriptions. When it comes to medicine, there is usually a brand name version and a cheaper generic version, right? So guess what? They work the same, so why not save some money and go for generic? Your wallet will thank you for sure. This should not be interpreted as medical advice, and of course your doctor knows best what works for you, so in certain cases it may not be the option, but I had to mention it, okay? So, and one last thing, once you've visited the doctor, had tests or had a surgery, please do yourself a favor and check your medical bills, okay? Mistakes happen and you don't want to pay for something you shouldn't. If you spot any weird charges, don't be afraid to ask questions. It's your money after all, okay? So you have no idea how many times I've seen cases where the doctor or the clinic did not take the ID card from the patient and has no information about insurance. So instead of sending the bill to the insurance company, they just send it to the patient. If this happens, kindly provide the doctor your ID card. If you indeed received a large medical bill and all looks legit, but the bill is too high for you and you can't afford to pay, you may want to use the charity programs. Most of the hospitals have charity programs that could reduce your medical bill by 50%, 25%, or even 100% in certain cases. If you qualify, it's based on income, so you may want to try that and see if it works. Also, negotiating medical bills is another option you can use. If you don't have the guts to put up with the bureaucracy of medical billing, then you may use the assistance of healthcare advocates that will help you resolve medical billing issues. I will have resources in the description of this video so you can explore it. And I think that's it for now. If you know any other ways to save money on healthcare costs, please share your thoughts with us in the comments. People would greatly appreciate it. So yeah, thank you for watching this, and remember, taking care of your health doesn't have to break the bank. With a little know-how, you can stay healthy and wealthy. Thank you.